Hi, so today I am going to take class on the topic passive diffusion. Passive diffusion is a type of diffusion which is an important step in the absorption of drug. Absorption is an important parameter of pharmacokinetics. So, diffusion means the movement of the drug from a region of higher concentration to a region of lower concentration according to the concentration gradient. So, it moves from a direction of higher concentration to the lower concentration until the equilibrium is reached. This diffusion method is facilitated by different types. That is, the movement of the drug across the cell membrane is through passive diffusion, facilitated diffusion, active transport and endocytosis. Today we are going to focus on passive diffusion. So most of the drug particles cross the cell membrane through passive diffusion. Okay, that is the movement of the drug particles from a region of higher concentration, that is gastrointestinal fluid, to a region of lower concentration, that is when it reaches the blood. This passive diffusion doesn't require any kind of energy input. And the rate of absorption of the drug particles through passive diffusion is predicted by a law, namely Fick's law of diffusion. So, what does Fick's law of diffusion says? It predicts the rate of movement of the drug particles across the cell membrane. The formula is dAb by dt equals to Cu1 minus Cu2 into Pm by Th into SAM. So, dAb by dt is the rate of drug diffusion, that is at what rate the drug crosses the cell membrane, that is the rate of diffusion. Pm is the permeability of the drug through the cell membrane, that is how fast a drug crosses the cell membrane, that is termed as the permeability of the membrane. Then SAM is the surface area of the membrane. Coming to the Cu1 and Cu2, Cu1 is the concentration, higher concentration of the drug molecule, and Cu2 is the lower concentration of the drug molecule. And the difference of Cu1 minus Cu2 is the concentration gradient. And thickness is the how the cell membrane is, whether it is thick or thin, that is the Th. So what are the factors that affects the rate of diffusion? So there are basically four factors. One is the concentration gradient, that is the difference between the higher concentration and the lower concentration. Then permeability of the membrane, that how fast the drug crosses the cell membrane. Th, thickness of the membrane, and surface area. How this factor affects the rate of diffusion? So whenever the concentration gradient value is higher, whenever the difference between the drug concentration is high, the rate of diffusion will be higher. That is, it is directly proportional to the rate of diffusion. Then permeability, the amount of drug that crosses the cell membrane and how fast it goes also is directly proportional to the rate of diffusion. Surface area also is directly proportional to the rate of diffusion, that is, if the surface area is more, the rate of diffusion will be more. For example, small intestine. In small intestine, we have a larger surface area where the drugs can be easily absorbed. So, surface area increases, rate of diffusion also increases. Whereas in thickness, let's say this is the cell membrane. Here there are some drug molecules. These drug molecules can easily penetrate this cell membrane, which is thin, and it can cross the cell membrane and reach to the other side. Whereas if the cell membrane is thick, the drugs might find it difficult to cross the cell membrane easily. So whenever the cell membrane thickness is larger, the rate of diffusion will be low. This is what the Fick's law depicts.